name is David Young. I'm a plastic surgeon at St. Mary's Medical Center here in San Francisco. I'm a board-certified plastic surgeon. My training has been in reconstructive plastic surgery. My first job was as the director of the burn center here in San Francisco, and I treated a lot of badly injured patients. And from that experience, I've learned that I really love returning people and reconstructing people back to their normal lives. And that's the philosophy that I've taken to here at St. Mary's. You know, here at the Wound Care Center, we really offer two approaches to treating the patients with chronic wounds. We offer both surgical as well as non-surgical treatments. And my approach to seeing a patient the first time is to really individualize my treatment to the specific patient. We do a full physical examination, I take a full history, and then I talk to the patient and try to understand what it is about the wound that has been most bothersome to them. For each individual patient, sometimes it is to actually get the wound healed as quickly as possible. Other times it's just to minimize the effect of the wound on the patient. In other words, wounds frequently disrupt patients' quality of life, and our goal is to try to minimize that. Sometimes surgery is the best option, it's the quickest option, and it's the best option, but there are other times when the surgery isn't the right option. It may take a little bit longer not to do a surgical treatment, but sometimes that's best for the patient. I think the main difference and the reason why I actually like working at St. Mary's so much is the level of professionalism and the training of the staff here is one of the best that I've seen in the whole Bay Area. But in addition to that, St. Mary's is more of a personal place. I've worked at a lot of large medical centers, and I find that the patients and the physicians get so compartmentalized, so specialized, that the physician becomes just a treater of like a body part or a certain disease. But at St. Mary's, I find I'm able to treat the patient completely, that the center that we have is really geared towards treating the patient, all of the patient's problems. We have multiple specialists, but we all combine our specialties to treat the patient, not use our own individual expertise to sort of build our own individual compartments to put ourselves in.